Surgeons, you need to avoid the dozen surefire behaviors that will cause you to fail your surgery oral board exam. The second one is anger. I've seen hundreds of candidates get angry under exam conditions over the last 27 years. I realize it's difficult to imagine that any candidate would get angry in the setting of such a high-stakes event as the surgery oral board exam. Yet, when it happens, anger in a candidate is almost always a visceral, non-conscious reaction to the high stress of the exam, with amygdala activation of the fight, flight, or freeze response. Anger by the candidate can be generic due to frustration or fear, or can be specifically directed toward the examiner when the candidate feels the examiner is being unfair. Honestly, the exam is incredibly arbitrary at its baseline, but it does have constraints, rules, parameters. So rather than get angry or frustrated, it's better and easier for a candidate to recognize the realities of the exam and develop effective approaches to dealing with them. Even a hint of anger by a candidate is never tolerated by a board examiner, and the candidate always fails, at least the scenario and often the entire exam. Send me a note. Let me know if you'd like me to create some posts in which I give examples of anger during an exam setting. Avoiding the dozen surefire ways to fail the surgery oral boards can be done with optimized preparation under experienced guidance. Call me with any questions. I'll be happy to answer them.